In this video, I want to dive into the mysterious and often dangerous world of ancient Greek childbirth. Childbirth at this time was a deeply significant but risky experience. It was heavily influenced by religious, social, and medical beliefs. So let's explore how ancient Greek women gave birth, who helped them, and what happened when things went horribly wrong. If you enjoy exploring how medicine has changed through the different ages and cultures, please subscribe to my channel, Doctor of the Ages. Childbirth at this time was exclusively a female domain. Men, including physicians, were almost never present during delivery. Instead, midwives, or Maya, who were skilled and experienced women, assisted in the process. Elderly women or wise women who had given birth multiple times would also act as birth attendants and counsellors. Formal medical education didn't exist for women at that time, but midwives often received hands-on, experiential training. They may have learned via observation and by practically assisting an older midwife. Knowledge of herbal remedies, birthing positions, and postnatal care was passed down from woman to woman, often within families or tight-knit communities. Rarely, midwives are referenced as being well-read in medical theory. However, the respected and well-known Greek physician, Soranus of Ephesus, described the ideal midwife as literate, calm, experienced, and even able to perform some forms of surgery. This would suggest that there may have been an upper tier of highly educated midwives in certain cities. Women would typically give birth in a squatting or semi-seated position, often with the help of a birthing stool. This was a low 3- or 4-legged seat with a U-shaped cutout in the middle to allow the baby to be delivered below. For pain relief, herbal medicines, compresses, and possibly in some cases, opium-based remedies were used. Chanting, incantations, and invoking goddesses, especially Artemis and Alethea, the goddesses of childbirth, were common during labour. Amulets and charms were often worn or placed near the birthing area to protect the mother and baby from evil spirits or misfortune. In ancient Greece, childbirth was high risk, and when complications arose, midwives and healers relied on a mix of physical techniques, herbal remedies, and rituals to manage these complications. The tools and materials were simple, but knowledge was surprisingly practical, passed down through generations of women. The ancient Greeks will have used linen or wool cloths to catch the baby, clean fluids, bind wounds, and wrap the infant. Midwives likely tied the umbilical cord using linen thread and cut it with a sharp knife or flint. Herbal compresses and oils made from plants like myrrh, mint, and barley were either applied to the abdomen or inserted vaginally for stimulation or healing. Women usually gave birth in warm rooms, and in some cases heated stones were wrapped in cloth and placed near the women. These fabric-wrapped warm stones were sometimes applied to the abdomen or lower back to soothe cramps and encourage contractions. If the baby was in a breech or sideways position, a skilled midwife might attempt to turn it manually, a technique known in later texts like those of Soranus. This technique required delicate internal manipulation, which was done at the time without sterilisation, making it pretty dangerous. It may have led to injury or death of the mother or child. In cases of prolonged labour or failure to progress, midwives might use herbs like pennyroyal, rue, or silphium to induce contractions. Massage, hot baths, and even shaking or jolting the women was sometimes attempted to loosen the baby. Rituals invoking Alethea or Artemis were used if these physical measures failed. C-sections were not performed on living women in ancient Greece, as far as we know. They may have attempted a section post-mortem to save the child if the mother died during labour. Postpartum hemorrhage or bleeding after birth was a major cause of death at this time. Remedies for excessive bleeding included tight bandaging of the abdomen, application of cold compresses or herbal poultices. Astringent herbs like rue were also used to try and help close the womb. So as we can imagine, childbirth was very dangerous. Death in childbirth was common and infant mortality rates were very high. While we now know some empirical knowledge existed, there was no modern understanding of infection or how to effectively manage complications like breech births or hemorrhaging. So postpartum, while the level of care varied by social status and region, Greek women were generally given time and space to heal, both physically and spiritually. The first few days after giving birth were considered dangerous, as a mother was seen as physically weak and spiritually vulnerable. During this time, she often stayed isolated, especially if there had been blood loss or complications, which was probably quite sensible. After childbirth, a woman was also considered ritually impure. She could not enter the temples or participate in religious life until she underwent ritual purification, and this usually involved bathing, often in special water with scented herbs, burning incense, and waiting a designated number of days, often 40. This rite marked a return to public and religious life. So I hope we now have better understanding of medical practices and rituals relating to childbirth in ancient Greece. I hope you found this video interesting and informative. If you did, please do like, share and subscribe to my channel, Doctor of the Ages.